My name is Joe Peroni, and this is the Rise Above Project. And today I'm going to continue my talk on ADHD. This is going to be part 3. I'm going to answer a few questions, but the main focus of today is to talk about the gut-brain connection and how it affects ADHD symptoms. First question, is ADHD genetic? There does seem to be a link between ADHD and genetics. And this is because it runs in families, so that's the obvious answer. However, upon further analysis, there are many things that run in families, such as whether they care about exercise, whether they care about nutrition, how they deal with the daily stressors of life. Does the family deal with alcohol and drug issues, trauma issues, all these types of things? So just to say that ADHD is genetic because it runs in families absolutely makes no sense. But just for argument's sake, because there are people that are just going to hang on that and to say, well, it definitely is genetic, although there's really no evidence to show that. Let's say there is evidence to show that. Well, in this case, we can say that genetics definitely loads the gun, so it would be there. However, it's behaviors, decisions, choices, and lifestyle that pull the trigger. Therefore, every individual has tremendous power and agency over whether they're going to continue to experience these symptoms or not. Question number 2, is ADHD a brain disease? Well, that depends on who you're asking and what your perspective is. If you ask an MD or a psychiatrist, they're going to say that it is a brain disease. And most likely, they're going to prescribe amphetamines, such as Adderall or Ritalin. They're going to do this to increase dopamine, and the dopamine is supposed to decrease the ADHD symptoms. It makes sense, and many times it works. However, is that a good thing or a bad thing? Well, obviously, if you're experiencing symptoms and they go away because you're using these medications, well, then it seems to be a good thing. But let's look into this a little bit further. Number 1, when you're a medical doctor, number 1 here is that in order to obtain an MD license, they don't have to have any formal training in exercise or nutrition. So they're going to go straight to the drugs. And what does that do? It goes after the symptoms, not the root cause. Now, for a second, let's go to the psychiatrist. They're trained in psychotherapy, but heck if you can find one who actually does psychotherapy these days. They tend to act like medical doctors and they prescribe drugs. And for sure, a psychiatrist has no formal training in diet or exercise. Now, it's possible that they have an interest in it because they've started to learn and understand the importance of diet and exercise, and they can easily get that information on their own. However, in their line of practice, they tend not to use that. They tend to rely on the medications. So for argument's sake, let's say the medications work. All right, so you're working on the symptoms. That means you're not working on all the root causes that led to that problem in the first place. So typically what this does is it discourages an individual for taking on all of the other choices that they have, such as changing their behaviors and changing the way they're living their life, which could and does, and the evidence will prove without a shadow of a doubt, that it could eliminate all these ADHD symptoms. Now, if you're taking the drugs and you're not doing any of the other lifestyle changes, it puts you in a position where you may never feel good unless you're on drugs. And so does it really solve the problem? All it does is mitigate it for a little while. And now you're stuck having to take drugs forever to feel okay. Here's something else, because I know a lot of doctors will say this and psychiatrists. They go, well, I make people feel good. The drugs work. Okay, they work. So when somebody's driving down the street on a Friday night and they've had a really stressful week and they stop by the bar to get some alcohol so they can mellow out a little bit, Does that work? Yes, alcohol works. And if you want to increase your dopamine a lot, you can use things like cocaine. Does that work? Yes, it does. Is it healthy? Not even close. So whenever we're relying on a drug, instead of using our own minds and our own bodies to fix the problem from the root cause, eventually all bills become due and payable, and we're going to end up having some major problems. Now, as a slight aside, but I still think it's worth saying, a lot of people today are using marijuana in order to decrease their anxiety. And that might be true. It can work, and it does work, if you're using it for medicinal purposes and in the right ways. However, there's many, many people out there that are using it on a daily basis, and not just on a daily basis, they're using it multiple times per day. So whenever they start to have an inkling, or just maybe they just might have a feeling or an emotion, they go right to using the drug because they don't want to feel anything. So what does this do? What happens here is there is a steady decline in their natural ability to handle the daily stresses of life and to handle anxiety. One could say that the use of marijuana actually increases your anxiety. Not the drug itself, but it's the reliance on it. And we could say the same thing with ADHD. All these symptoms are actually going to get worse because you're not going to be doing the right things in order to reverse these symptoms. So here's a question. Would I say that drugs are a crutch? My answer to that is absolutely no. Drugs are not a crutch. It's an insult to crutches. For example, if you have a sprained ankle and you use a crutch, what you're doing is you're taking weight off the ankle so the ankle can heal itself in time. And eventually you can get rid of the crutches, and then you could go walk and you can run and do the normal things in your life. However, drugs don't do that. It doesn't make you heal from the inside out. What it does is it makes you rely on something from the outside, and you never end up getting to the root cause. So it's definitely not a crutch. It makes things a lot worse. Now, can dopamine be increased naturally? And the answer to that is absolutely yes. So why don't we do that more often? You know, because it's easier to pop pills, right? So a clinician who has a holistic perspective, they believe that ADHD is a symptom of the body, not just the brain. It's a symptom of the body. It's a symptom of overall inflammation of the body due to poor nutrition, a sedentary lifestyle, and poor life management skills. So now that we know that we can raise our dopamine naturally instead of taking the pills, and we could hit the root cause. How do we do this, number one? And where is this dopamine? Like how can we increase it? Well, here's the interesting part that most people don't know. 50%, 50% of dopamine and about 90% of serotonin is actually created in the gut. Now, I'm going to continue to use the word gut because saying gastrointestinal tract gets a little bit wordy, so I'm just going to say gut. But it is created in the gut. Now, intuitively, we know this, even if you didn't think you did. Let me ask you a couple of questions. Have you ever been stressed enough and then you experienced a decreased appetite? Have you ever experienced grief and loss to where you lost your appetite completely? Have you ever had butterflies in your stomach because you were just so nervous or scared to do something? Did you ever feel abdominal pain when you were hurt emotionally? Of course you have. Everybody has. We're human. We've all felt that. The reason why there's such a connection to the gut and the brain and emotions is because the gut-brain axis includes communication between the central nervous system, which is the brain and the spinal cord, and the gut. So now that we know that, what are our choices? What should we do? Should we take more drugs? Looks like the answer is probably no. I think we need skills, not pills. Solution number one, nutrition. Here we're looking at increasing fiber to promote probiotics. We want fruits, vegetables, lean proteins. You've heard this before, but people don't want to listen. Hopefully now. Number two, exercise. It helps maintain the gut biome balance. Again, what does that do? It helps out the brain. We want to be able to manage our daily stressors. We want supplements in the form of zinc, magnesium, iron, vitamin D, and omega-3 fatty acids. Where do you get omega-3 fatty acids? Salmon, avocado, olive oil. Think Mediterranean diet. Something else that's very important here. I mentioned vitamin D. Vitamin D is not created in the body. Where is vitamin D created? By going out in the sun. And again, here's something else. If we have these kids sitting in front of screens all day, and I know you've heard this and it gets boring and it sounds so cliche, but when are you going to listen? Because if we have kids inside all day, every day, instead of running and jumping and doing what they're supposed to do, climbing trees, going to the beach, running around the block, doing whatever outside, this is what's causing the gut biome problem, which is causing all these other issues in their brain. So again, vitamin D supplementation, just go outside. It's not that hard to do. And I'm going to back this up with some interesting studies here. Now keep in mind, there's too many studies to mention. There's hundreds. So number one, from the Scientific Reports, December 2020, conclusion, exposure to bacteria in nature improves both gut health and behavior among preschool age children. Conclusion, go outside and play. Get off the drugs. You know, it's amazing to me. We have MDs and psychiatrists that would say, okay, so they have uppers and downers, but they don't want you to get recreational uppers and downers, drugs off the street. Now, nobody would, right? But here's the thing, they replace it with their own drugs that do basically the same thing. Why? So they can make more money off of it? Like, this makes no sense. Just go outside, play a little bit. Number two, applied psychology. Conclusion, regular time in nature reduces ADHD symptoms. Number three, from the complementary therapies in medicine. Conclusion, exercise alleviates ADHD symptoms in kids and teens and has positive effects on the gut microbiome. Number four, from the Public Library of Science, October of 2019, adequate sleep is correlated to a decrease in ADHD symptoms and is crucial for gut health. You know, I hear this a lot too. Well, I could go to a doctor and I could get prescribed drugs, and somehow that's cheaper than following a good diet. I'm like, well, okay, let's not argue that point. Let me give you that one, even though I shouldn't. How about sleep? How expensive is sleep? It's a problem, right? Because sleep could handle a lot of this issue right now. So again, how hard is that? Just get some sleep. Number five, from the European Journal of Clinical Nutrition, they studied over 15,000 school children as a part of this study. Conclusion, plant-rich diets are correlated to a lower risk of ADHD symptoms. Diets with processed foods, cereals, hot dogs are linked to ADHD. Does that prove it enough for you? I could go on, I could do this all day. There's too many studies to mention, so I'll just leave it at that. What's my conclusion here? Well, here's something interesting to know. At present, there is an Adderall shortage due to high demand. What I think is interesting about this, there's a high demand in two places. The people who want it, who go to doctors, who are telling the doctor that they'll go somewhere else if they don't get these medications for their kids. And these doctors, let's not say if they're ethical or not, but they don't want these clients to go somewhere else, so they write a prescription for methamphetamine for their kids. We're talking about Adderall and Ritalin here. That's one part of it. How about the other part of it, of doctors knowing full well that all these lifestyle changes can, in a sense, put them out of business, mostly, but they're not talking about that. They're writing prescriptions so fast that they're getting cramps in their wrists and their fingers. Is this ethical? Especially with all the information that's out there? I don't think so. So yes, there's an Adderall shortage right now due to the high demand from doctors and their clients. You know what else is a shortage in too? There's a shortage of people willing to take the time and effort to live a healthy lifestyle. A shortage of people trying to deal with their daily stressors in a correct manner. A shortage of people willing to go for a walk out in the sun. A shortage of people willing to eat fruits and vegetables instead of that garbage processed foods that have all these colors and dyes in them. That's where we have a shortage. So we have to remember this. ADHD is not caused by an Adderall deficiency or a Ritalin deficiency. It's caused by a deficiency in discipline, a deficiency in nutrition and exercise and basic well-being and the ability to connect to other people. Hopefully this has been beneficial to you in some way. My name is Joe Peroni. Please subscribe, tell a friend. It's the Rise Above Project. Thank you.